Welcome to Age to Perfection, the podcast that celebrates the beauty of every stage of life. Today we're exploring the powerful and often challenging topic of body image. In a world ruled by TikTok trends and Sephora queens, how does this cultural obsession impact teens, adults, and everyone in between? Together, we'll unpack the pressures of social media, hear personal stories, and share insight on how to appreciate, celebrate, and truly care for the amazing bodies we call home. Hi, everybody, and welcome to Age to Perfection with Dr. Patel. Today, I have two very amazing guests with me. Gina, who is actually a mental health therapist with over 10 years of experience and 2 state licenses. And so she's had extensive experience in these things. And then we have Melisa with me. And Melisa is a former teacher, mom of 4, and especially 4 girls, 5 kids, 1 boy, 4 girls. And I think today I wanted to invite both of them to discuss body image. I feel that is something that my profession is personally or should personally take responsibility for in today's day and age with Instagram, Facebook, everything that goes on. So let's dive right into it. Cheers, ladies. And then for our wine today, I picked a nice, big, bold Bordeaux. I actually thought about doing the skinny girl because, let's help other female entrepreneurs. But to me, I feel like this topic is not something that we need to give into. I think this topic is something that when I think make a stand for who you are, I think of French women. I mean, these women managed to make not shaving a norm because they're like, I'm gonna do what I want to do. And so we thought, nice juicy Bordeaux for the occasion.
Yes, it's good.
Okay. So I will tell you that I think in the last decade of me being in medicine, I have seen a big change. And these are things that we've talked about in between us. We've seen a big change in my patients. And when I say a change, I feel like the things that were affecting my patients in their 20s and in their 30s are now affecting us at a much younger age. What we're exposed to has changed. Social media is now such a big part of our lives. And so mental health has made a big change in the last even 10 years, right, Gina?
Yes, it has. Yes.
Tell me some of the, I guess, more astounding numbers that have come out in the last 10 to 12 years with mental health, as far as rates of suicide, as far as rates of body harm, eating disorders.
Suicide has significantly increased, and one, though, that has gone down that I just read the other day was drug use amongst young adults and teens. There is a decrease in drug use, which is good. Yes. That's great. Yes. Teen suicide, childhood suicide is on the rise. Eating disorders, that's huge. And
I feel like it's shifted. The demographic that affects eating disorders has shifted.
To younger people, much younger people. Everybody wants to be thin, they want to do this. But now you have the little children who are looking at mom who takes meds or diets constantly or excessively exercises. And now you have a little one who's doing these things or doesn't want to be fat or wants to diet or doesn't want to eat this or will eat this,
So when I thought about doing this topic, my initial perspective was going to be on let's talk about body image in kids, because this past summer I had so many moms coming in and bringing their 8, 9, 10-year-olds because they were seeing things on TikTok, and they had these rashes because they're buying things at Sephora and off of the TikTok store. And I don't know why a 10-year-old needs 8 products, but these things were happening. So initially I thought, but like you said, I had to take a step back and be like, you know what? It actually starts with us. It doesn't start with them. It starts with us, and it's what we're showing them. It's what we're putting out, right? So from a professional standpoint, there is that extreme point that you reach, right? We call it body dysmorphic disorder.
Yes.
Tell me a little bit about the criteria for body dysmorphic disorder.
So it's excessive. It has to be excessive. I feel there's different degrees because
yes.
But I may even think I experience it because it's a flaw. So we find this flaw, right? Mm-hmm. And we obsess over it. and nothing, and then we'll get that taken care of or help it, come here and get some procedure done, laser, whatever. So it does make it better. But now we find something else and it just doesn't end. Some people, it's so terrible. They won't look in the mirror. Yeah, and how many of us really do look in a mirror,
Well, so, it's funny when I was reading, if you look at how we're taught in medical school, you say, okay, this is how you, as a physician, screen for body dysmorphic disorder. Like you said, they don't want to look in the mirror. They hate the way that they look. They're not happy in any clothes or any makeup or anything like that. But then, like you said, is it that extreme, or does it start with the other spectrum? Does it start with the constantly look in the mirror?
Right.
Yes.
Because you have to notice it.
Right?
You have to notice what's wrong. This flaw that could be so minute that nobody else sees it, but it's like becomes like your life depends on this.
And we all have it, by the way. Mine are my under eyes. I hate the fact that I have dark under eyes, and it's genetic for me. There's nothing I can do to change it, but for some reason, bothers the hell out of me.
Well, I was a picker because of anxiety, truly. Talking about generational things. I used to watch my mom sit and pick at nothing. I never had, I may have had a pimple here or there. I never had acne but I would pick, and it was like a control that I became obsessed with it. Now I don't do it anymore because I hurt myself. We self-sabotage doing these things, but so that's something for me. Yeah, I want to fix like this, but I can't. And I know, and I can't obsess over it. And I do everything I can to make it better. But, it does start at home.
Yeah.
That it was truly passed on to me from watching my mom. I could see her right now in the mirror.
Now, you have 4 daughters. What age do you think that kind of started? Because yours are now they're grown. But they did grow up with the Instagram and social media.
That's when I think the cell phone. I really do. I feel like that it changed things but it was the social media because, my oldest, she's 26 and they did not have Instagram back. It's only been around, 10 years?
Yeah.
So I really feel like that was a shift too, where it's going younger and younger. They're doing, mine do it where they're wanting procedures done. And I'm like, whoa, like you do this after you have battle scars, that was my approach.
Right.
Like you had to earn
those things.
It's not something that you should just be doing at the drop of a hat to mirror what you're seeing online, which is probably 100% fake.
But how do we tell them when we are guilty of that?
Well, true. But then I feel like there's a certain age where it might, like in your 30s, whatever.
So what is that age?
I feel
What's
like
that
you're
magic
an adult.
age? Because that age is changing.
I know now it's like they're starting at 15 or what you're saying 10. I had no idea about that.
Yeah.
Sephora. But they're doing all these cleansing. But then I think my mom sold Mary Kay when she had me on a cleansing regimen I had acne so bad, did Accutane. Yeah, so maybe it's always been there.
It has, I think. It has always been there.
It has always been
it's
there. But
different now.
But here's a part of it, and this is the other side of that flip coin you were saying before. I will tell you, when you look at marketing, just if you ask any marketing person, that now we have the capability to advertise to a specific area code, age group, financial demographic. Like we can literally narrow it down to pinpoint you exactly on that street corner to show you the ad that we want to show you.
Right.
Yeah.
And I feel like on purpose now, we are targeting younger and younger demographics. And I think that is where some of the corporate responsibility needs to come in too, is we need to make sure that we are protecting these things from being exposed to younger and younger age group.
Right.
Personally.
Yeah, let them be kids. It's just, they're becoming too grown up.
But then coming back to your point on acne, right? So to me, I was thinking, okay, we know multiple studies have shown that the better looking you are, you're going to close that interview. You're going to close the deal. You're going to get the contract. We know that admissions into any kind of programs, looks matter. They've done research studies on little kids and have given them different sizes of dolls. And they've realized, hey, no, kids really do get attracted to facial symmetry and body symmetry and things like that. And so we're hardwired to find certain things beautiful. We're hardwired to want certain things. And yes, it links to success. Yes, it links to confidence, right? Yes, it links to, hey, I feel good. My inner mental health is going to be good because I feel good. And so that brings me back to acne. It's like, so then what is it? Where is it that this is okay for confidence? And then this is a step too much.
Well, I don't know.
So what if one of your daughters comes and says, well, I hate the acne. I want to do this, and this procedure for my acne scars. You're going to say, okay.
Yeah, I feel like that's okay.
Okay, but what is not okay?
I don't know. I mean, procedures meaning like
Anything. Botox, fillers, lasers, anything.
like, I'm okay with the scarring, but I'm like, there's to a point where I'm like, that's too much. You know, these girls, and then I started with implants and things like that, you know, different
And the
things.
plastic surgeries.
Yes, the plastic surgeries. So
is there a recommendation for, from a professional standpoint on, hey, these are the ages or these are the signs and symptoms you look for in your kid that's getting things, or yourself?
I think if they
signs and symptoms in ourselves.
And you're right, because it is any of us. I mean, even sometimes I have to take a step back because I love this place. But I have to take a step back and realize, wait, you're a real person, and whatever it is, it's okay. Aging is huge for us. My age.
Yes.
50 is coming, and
I'll be 51 next week.
So it's hard. But again, that's something I went through with my grandmother. I watched my grandmother and great grandmother. However, I don't, there is a line, and we have to watch with obsessing over things. I think that's important, or
are there small signs that we should be catching in ourselves?
Well, I think the obsessing, looking, oh, I want this.
Okay.
I scroll and look, and I'm like, oh, I want this, or I want this, or I want, how many emails I have sent to Jamie. Like, can I do this? Do you do this?
Yeah.
But then the reality of it is we are still these humans who are going to have flaws, and it's okay. It's okay. As far as acne goes, though, I do want to say this. I have been seeing a lot on Instagram is the platform I like. There's women and men are coming out and like showing their acne scars, and they like it. Not that they like it, they're okay with it, and they're okay showing it. And I think that's great. So
that is great.
It is good.
As far as social media goes, there's a downside, but there's an upside to it too, which is
what's the upside?
Well, I think the upside is the positive. You see other people, and there are
that you can relate to,
right? You can. And the mental health of it, because you do see other people going on, and there's mental health support. And that part of it isn't so bad. But then when you're seeing a 50-year-old who looks like she's 20, and I'm like, well, why can't I do that?
Yeah.
What's wrong? Who does this?
Yeah.
Well, and I think the root of it all is FOMO, right? We're all afraid of missing out. So it's funny because I was talking to a couple of the school moms, and they told me, and this really resonated with me. She said, I feel like we are in a generation and a time that she's like, now we're all creeping up on, they're all 40, we're all 40. And they're like, if I don't do something now, it's going to be too late. But they're like, half the people are doing it and half the people are not. I don't want to wake up at 55, 60 and be like, oh, I look so much worse than they do. But she's like, at the same time, I don't know that I want to buy, but I don't know that I want to. I want to maybe do it the same way my grandmother did and my mom did, right? And so I feel like that's also another almost peer pressure that you wouldn't think that you would have peer pressure at this age.
Oh, I think so. Right. You wouldn't think, but oh my goodness. It's serious.
But it is, it is in the school PTA playground.
Oh my gosh.
Right?
But this is everywhere.
It's everywhere.
It's apparently, unless you're like 25 or under, you're just like disappear like nowadays,
Yeah.
As a woman, I don't think men have that same, but I've noticed that. A little bit.
I think men are becoming more conscious. I think in the last 4 years, I have had definitely a 15 to 20% increase in male patients.
Okay, that's good.
because male, way back when, we could go to grandfathers, right?
Yeah.
Man had a big belly. He didn't
The
care.
dad bod.
Dad
Dad
bod,
bod.
you know? Now, come on now.
The definition of a dad bod is very different.
Very different. You know, even with balding in men, it's more
Yes.
acceptable. Graying, they're
Yes.
so it's different than my grandfather sitting in his chair watching the 7 o'clock news or whatever. You know what I mean? So times have changed, but men struggle a lot, and they're definitely coming out a lot more, even with mental health. I predominantly have women clients, but I do, and I'm getting an increase of men, and I love it.
Wow.
Yes, I love it. Even though it's a battle, the sessions are a battle.
Why aren't they a battle?
Well, because they don't want to hear. There's still nothing wrong. Now, listen, they made it to the appointments.
That's half the battle.
That's it. Now they want to argue.
Now they just want a quick fix.
Right. Not
Yes.
argue, but they don't want to dig deep. They're tough cookies, but they're workable. They're workable.
That's good. That's encouraging.
Yes, I'm glad. So I will tell you, as a profession, then when I have any of my patients, forget the age group, come in, and I can always tell you. So when I was saying like these are signs and symptoms, and you were saying obsessing, constantly looking in the mirror, constantly being
Constantly comparing. Yes,
and somebody else did it, so I need to do it, and that comparison is way more in our faces now than it used to be. But I feel like I have to do half your job, where I have to be like, listen, I know you're not happy about this, but it's part of life.
Right.
This is part of aging. And I think in my profession, not enough of us put this hard stops. I don't think not enough of us say, no, I'm not giving you that filler.
No, that's true.
And in your and it's so competitive. Yes. In your profession, though, there's a lot of people who just want the money and they don't care. And there's a lot of bad that's happening to people.
So the flip side of that is when I do have my patients or even a younger patient come in for something and I'm like, oh, I really don't want to do this for you and I don't want to do it, but I know if I don't do it, you're going to go somewhere else and someone's going to do it and they're going to mess it up. But at least if I do it, I'm going to control you as much as I can possibly control you. So I feel like I'm constantly fighting that battle within myself as the responsibility. Like, where is my responsibility?
Because you do care. You know, you do care and no, you don't want to do it, but you're right. And if you go to someplace else, and it could turn serious. Yes. I mean, there's a lot. My daughter went and had her, what do you even call it? Lipo 360.
Okay,
BBL.
yes.
Okay, she went to Miami by herself. Okay. It led to my daughter, she struggled with addiction because of that trip, because she was also sent home with
pain meds.
A lot, too.
Oh, my.
And nobody ever, on top
and
of
it was a procedure that was not even necessary.
No, not at all. And I tried to talk her out of it so much. But it didn't work. I couldn't. How do you control a 25-year-old? You know, I couldn't. Who had her own money. She didn't live with me. And she's calling me crying that she just got out of surgery. Now, the surgery went well, no infections. But on another end, like I said, there's addiction that comes out of these things. So, yes, I'm sure you're struggling. But if you don't do it, somebody else is going to, and it might cause other problems. So because you care, I wouldn't want to be in your situation because that's like, what do I do? I'm pulled in both directions here.
Yes. And I, with everybody now doing these things, there is a almost change in what we think is beautiful has changed too. Now everybody wants the same look. Everyone wants the.
Yes. Mm-hmm. What is that? This sucking.
I don't know. Notice none of you look like that. So
no.
Thank you. I do a good job.
Yes.
No, but it's like they just have cut off right.
Because everybody wants to look the same. Yes. Why does everybody want to look the same?
Because that image, whoever put this image out there, it's because it is this image, there's this one image and everybody wants it.
Yes.
Everybody goes after it. The stars are going after, the famous people are going after it. And everybody does. Everybody looks alike. And that's just the image, kind of like, the sneaker that everybody wants. But it is. And doctors are performing it. noses. People get their like nostrils don't even look like nostrils. They're like
Well, it looks like
or something.
almost like anime noses.
Yes.
Very much. I don't like that.
But
I'm
people
like,
are
what
actually
is
going in
that?
and asking for it, and surgeons are figuring out a way to give them. I mean, how many people
My
do we heard of?
God.
I'm the human Ken. I'm the human Barbie.
Yes.
They're spending $1 million, $2 million on these procedures and things just to get that look. But I think that's the extreme, right? I feel like my day-to-day job is to, one, make sure my patient's happiness, and I think this is, and correct me and please give me pointers. I feel like as long as their source of happiness doesn't come from their outer image, I think for me, that's the checklist that I make in my head. It's like, is this because now you're just not happy? And do I need to give you other resources? Or no, it's a legitimate, like, let's work on a little anti-aging. We have the science, we have the technology.
Yes.
and we could do it.
That's right. The health, you're doing the inner health here. Well, you guys are really good with the, the IVs, the hormones, the peptides. I mean, that's what I think overall helps you.
But that's how anti-aging is supposed to
Yes.
be, right?
I love it.
Renew is not just a med spa. We're an anti-aging clinic. But we're talking about your average, everyday, street corner med spa.
They shouldn't even be
And there's
allowed.
so many of them. They're on
Shouldn't be
every
allowed.
street corner.
They
now.
shouldn't. I don't like that.
No.
I mean, California has laws. They're coming into Texas, but
good.
they're still not there. Anybody can inject in the state of Texas.
I read that. That's scary.
That is very scary.
Yeah.
Your hairdresser can inject you with
Yeah.
Botox in the state of Texas.
No.
Yes.
You don't have to have any medical. I just recently read that.
Okay, I
yeah.
have no idea.
To become an injector. That's what you go to be an injector. You go to classes or a certificate or whatever you do. Yeah.
I can't tell you how many resumes I get that, I'm a trained injector. I'm like, where's your college degree?
Yeah.
Like, do you have a medical profession degree? Like, are you NP, PA? Like, where are we?
Do you ever have botched? If people come in with botched things?
Yes.
I was gonna
I
ask.
actually call them more my Groupons. It's actually,
Oh, okay.
yes.
Yes.
The
Okay.
Groupons.
Yes.
Yes.
So there's a lot of the Groupons, or I saw someone do it on TikTok. Okay, this past year, I had 4 Amazon chemical burns. Big 4. They bought chemical peels on Amazon, which you
That's what I
can.
was trying to get out. They sell them on Amazon.
Yeah.
You can buy fillers on Amazon. What? You can get on Amazon right now and buy hyaluronic acid filler and inject yourself with it at home.
Oh, no.
I had no idea. I didn't know.
Yep.
But California regulates it.
California regulates it.
So they probably can't. That's
Like,
why a
you
lot of
have to
times
have
it
an
says-
NPPA or an MD doing the injections or any medical procedure. Texas is
Pennsylvania
getting
too,
there.
I think.
Pennsylvania's
Yes.
like that. Texas is coming now. Texas has made the new laws that just came out that you have to have a physician oversight and the physician has to do what you do. You cannot have an ER doctor that's on his way to retirement
Right.
be the overseeing person to do fillers.
Right.
The man's probably never done fillers in his life.
Yeah.
Right.
No.
Right.
Right? But back to kind of our topic. I make this mental checklist for myself too, right? Anytime I see, you know what? I really hate that this fold is coming in. And then I look at, do I really need it? And then if I do need it, is it for the beauty or is it just I'm trying to prevent? And I think it's a very, very slippery slope. Where does, so I saw this recent study that now the new generation is spending way less on alcohol.
Oh, yeah. I did
You-
too.
did
Because
you
they're
see that?
getting procedures. Yes.
So
Addiction, though, on both.
So the end game is a serotonin hit, right?
Right.
We all want a dopamine serotonin hit.
Yeah,
We want the
absolutely.
add to cart.
So, yeah, they'll stop buying alcohol. I don't even know if cigarettes really
They
exist
don't.
anymore. I don't
Vaping,
think that's
but very little.
That's gone out the window. Alcohol, the drug use. I told you I read the study about the drug use, the decrease in drug use, which is great. But that's why I was reading it because it goes more to they want this done, they want that done.
They're saving all
Yes.
their money for that.
But they're getting this high.
And the
off
high,
of it.
too.
Yeah, it's coming. The high is, you're happy. You feel good. I mean, you do. You walk out and you feel good.
Yeah.
So then let's talk about how do we address these things. So I'm going to set up an example. Melissa, you're at home. You're watching your youngest one. You've noticed in the last 2 to 3 months that she's been talking to 1 or 2 people online, and she's looking in the mirror a little bit more. She's spending more time in the bathroom. You're seeing some credit card bills come through for a few, products and things like that. What do you do what's the, like, how do we, and then she comes and says, Mom, I think I want fillers.
Oh, I have that all the time. But and
Where's
it's like
your
what you
stop
said.
gap?
It's like, where do you're 25, 21, and it's like, all you can do is just give them the best advice you can give, and then just hope that eventually it permeates the brain there. Like, because I have
What is the advice that you're, like,
I'm like, I wouldn't do
for
that.
the mom that has a 10-year-old out there about to get into all these years?
Nutrition and exercise.
Oh.
And
I didn't expect-
and praying. Honestly, put God in your life. Exercise. I feel like some of these new diets, the carnivore, the this or that, the gluten, I think are okay. I think they do help you. I think they're way better than our parents doing the cabbage soup diet, the dextrim, the grapefruit diet, tab only. Yes. These diets nowadays, I mean, there's so much more information.
Science behind it.
So I would say take XYZ supplement. Go for a walk, Don't do this hard cardio, like HIIT workout. Women should not be doing that all the time, because our hormones, I personally did it myself. I over orange theoried and I over crossfitted, but that would be my advice. Just like change your diet, drink more water, add maybe green tea. I don't know, just something. I don't know. That's the direction that I would go. I don't know what y'all, at 10, oh my gosh, I would have to hold my tongue back. I would be like, what are you talking about?
Let's talk about the holding the tongue back, because when we were younger and we talked about how the generational trauma comes in, right? We watched our moms obsess about this or that, but they obsessed in us. I remember I gained the freshman 20 and my mom was like, what happened? You need to go on a diet. You need to make sure you lose.
I was driving here today. I remember being called thunder thighs and thought it was okay. Like, what?
Yes.
That really popped in my mind. I remember this. But go ahead. I'm sorry.
No, you're good.
And we would do school pictures and my mom would make me redo mine all the time. I'm like, why do you care? Like, just like my kids did it. I wouldn't, this is great. I mean, like, why was she doing that?
So I think as far as us individuals go, I'm glad that we are, I think, one of the first generations to catch on to the whole, hey, let's recognize that this is generational trauma. And then let's try our best not to pass it forward, right? Yeah. And let's make sure our kids are. So one of the things I always tell and I advise my patients is, yes, I know you want the lips and the cheeks, and I know you want the amazing Instagram look that whatever popular 25-year-old has out there. But what does your body need?
Right.
What does your face need? What does your skin actually need? And then I think when it comes to personal, I always look at it as a need and a want. I make 2 categories for myself. I made a need and a want, and I tell my patients to do this too. Okay, you may not like something about yourself today. Fine, stop and look. In 10 years, is this going to be that big of a deal? And is it going to be that big of a difference? Is this a train that's going downhill? Right. If it is, address it.
Right.
You can address skin laxity at 40 and 50. You should not be addressing it at 20.
No.
You can address yes, and you can address volume loss with a little bit of filler and things like that as you're getting into your late 30s, early 40s to make sure that you're not getting too much of that hollowness. But I think that using fillers to just get lips and cheeks, and because that's what's in right now, I don't think that's the right way
to do it.
Right. So that's where I put the stopgap in my patients is want, need, and let's say, where is this going in 10 years? Those are the 3 questions that I ask myself and that I ask my patients. And mind you, I do have I have teenagers that I do toxins on. Yeah. But let me tell you, the teenagers I do toxins on, some of them have birth defects. Some of them have had previous trauma and injury, so that we're just addressing things because kids are mean and kids are cruel.
No, they are. Yes. Bad. I mean,
so I'm okay doing it.
So
and I've
bad.
done things for your daughters. One of the reasons I wanted you to come on is because I've always heard you have very healthy conversations in the room. Like Melisa will come in with all of the girls, and it's like it's hilarious to watch.
It's like a Lucy and Ethel show.
It is, and all the girls are like talking all at once, and Melissa's just sit in the center, like in this zen, like, okay, guys.
It takes a lot to be like that.
She's a school teacher. I mean, that says it all. She's great.
I was never really a school teacher. I wanted to be a school teacher.
I thought you had done education.
I did, but I never finished.
Got it.
Babies. Well, yes.
So how do you?
You are a teacher.
So now that you have 4 and they all come into the room, how do you keep them all from comparing each other?
Maybe that wooden spoon that I had when they were little kind of helps. I don't know. Because they don't really. I don't know. I've never noticed that actually.
I have. I've actually noticed.
You noticed? See,
I did. So I've always heard you do. I've always heard you kind of circumnavigate that. Be like, yes, I know your sister has it, but you know what? I don't think maybe we should think about this for you.
I've
noticed you do it. I'm like, wow, she does this like so expertly. Where I'd be like, sit your butt down,
right? No,
I don't know. I don't know. Gosh, I didn't notice that.
And I think the approach is important on how you say no to your friends, your sisters.
Yes.
Yeah. Forget your kids, forget your girls. But you said like we're all close to you have sisters, cousins. When they come in and they ask for your advice as a mental professional, what do you tell them?
I'm going to say, but you're so beautiful, because I mean that, you know? So that's the first thing I'm going to, but you're so beautiful. But then I think back to it, or I'll get it thrown back at me. Well, but you do this, and this. Okay. But, you know, one of my cousins in particular, she does different things, and her eyes, she has circles or
dark circle. Yeah,
I don't see it like she sees it. Again, that's
we all see
right. I don't
all have our one thing.
Right. I don't see it the way she sees it. But I told her at first, I was like, no, don't mess with your eyes. But then I told her, you know, if it's going to make you feel better, do it. She's a nurse practitioner, mental health nurse practitioner. But if you're going to go do it, then go do it if it makes you feel better. And of course, she's going to do her research, and she's not obsessing over it. But it is something that brings her down. So I'm going to also be the biggest cheerleader after I say, but you're so beautiful. And I mean that. I do mean it, you know. But then I'm going to be like, okay, come on, do you want me to drive you? What are we doing?
You have to have a balance.
Well, right.
I mean, you know, I think that's the key word.
Yes.
I think the key word is balance. And I think it's do it. If it makes you happy, do it. But like you said, you have to earn your battle scars before you get the right to say, it makes me happy, do it. And I think the one thing is, one, like you said, have you gone through all of these phases in life? Do you actually have something to address? Yeah. Do you even have a stretch mark, a loose skin, or anything like that?
That's where, I mean, that's how it starts.
Right?
I mean,
and then the balance. Like, I want to look good. I want to feel good. But my entire identity should not be wrapped up in that one flaw. And I think that's the key.
Absolutely. That's where the obsessing of it comes in, to the point where they won't go out.
Yes.
They'll cancel plans purposely. You know, actually eating disorders and BDD are
interconnected. Yes.
So eating disorders come into play.
So these are all good tips and clues for moms to look out. Like, are your teenagers canceling their plans? Are they, not breaking up with significant others? Are they not hanging out with their friends anymore? Are they changing their group of friends?
Changing their friends, right. Isolating. Not looking in the mirror, that's just so huge.
That's a big one.
With my therapy for people with depression and anxiety, this was something I did myself prior to even becoming a therapist. I had to learn to look in the mirror and say, I love you. It's so important. It sounds like the silliest thing, but it's such a hard thing to do. It's truly a hard thing to do if you're if you're at in a depressed state.
Can you tell me about that process? Like, what is that step? What do you do? I want to do it.
As funny as it sounds, I want you to do something, and we're gonna talk about it next week. I want you to look in the mirror and say, "I love you," and that's it.
Okay.
Nobody does it the first time. I didn't do it the first time.
Really?
Because it's so hard to do. It's really a difficult thing to do. And then I didn't even know that was a thing that people, that was, like I said, that was something I wanted to do for myself because it was something I didn't do. And we have to tell ourselves we love ourselves, because if we don't love us, who is going to love us? And nothing we get done is going to be good. It's always going to be something else. You know, I want this fixed, I want that fixed, but we have to learn to love ourselves. And that's very important. And we have to teach the children to love themselves from a young age. Let's sit down and talk instead of being like maybe our parents or our grandparents were, and strict, and you don't say anything, and everybody's so hardcore and nobody has feelings.
Nobody has feelings.
I do. You know?
And it's okay to have feelings.
It is so okay to have feelings. It is
okay not to like yourself.
That's okay too.
That's okay too. And then how
recognizing it, right? Yeah.
So give me what if I were in your chair and I had a session with you and I was struggling, give me homework for this week.
Okay, so what are we struggling with? Your body image?
Yes.
Okay, I would probably do the look in the mirror. I definitely, and look in the mirror and be honest. Now you have to come back to me and be honest, you know, because that's a part of it too, because we don't like ourselves. We're going to lie about it, right? We might tell a little fib to somebody else. We don't lie to ourselves though. So now you have to come back and sit. That's another difficult part. I think everybody's been honest so far, because the people I have done said, I couldn't do it. I couldn't do it.
Okay.
You know? Do you look in the mirror a lot?
I don't.
See? Do you look in the mirror a lot?
I don't really.
But it's also not I avoid mirrors. It's just one of those like, okay.
I don't know if I ever avoided it intentionally, but I wouldn't. I mean, we brush our teeth in the bathroom, right?
Mm-hmm.
How many times I never looked in the mirror, but we should look at ourselves. Do we ever really look at ourselves, you know, to know what's wrong?
That's a really good point.
Or we zero in on this flaw, right?
Or do we get out of the shower? And I don't know if you do this, but this was very bad post-baby. But I feel like after I had my kids, anytime I would look in the mirror, I only saw neck down.
Right.
Yep.
I never looked neck up.
No. And that's why I tell people to do that. But again, I do it. And now I do it every day. I make sure I tell myself, I love you every single day, and look in that mirror. I'm doing it while I'm looking in the mirror. Talking to myself. And it is difficult because it's something we don't do. We just don't do it.
Yeah.
And why don't we do it? We don't know.
I don't know. I want my patients to say, "Yay, I don't use a filter anymore. I don't feel like I need to put a filter on all of my pictures."
Right.
That to me tells me my patients have gotten to a healthy self-image.
Right.
That is
right.
That's true.
Is that they're not altering their photos before they're posting them.
And that's difficult too.
Yeah.
Because filters are everywhere.
And they're so much fun.
And
we look so good.
We do.
If you look, the Golden Girls poster that they had for their show, they were the same age as the last Sex and the City movie. And you see 4 women in each poster, and you see the difference in the way they look. Same ages, but one from
huge.
Golden Girls, one from Sex and the City. Huge difference.
Mm-hmm.
So our standards of beauty have evolved. And I think that's okay. I think it's okay to move with science. It's okay to move with medicine. It's okay to move with technology. But like you said, I think we also need to stop and realize that our self-worth and who our looks do not define us. Mm. And I think the take-home message is I will go home this week and tell myself I love myself. In the mirror.
I want to know about it.
Okay. All right. Thank you so much for joining me, ladies. This was a lot of fun.
Yes.
Thank you. Cheers. Okay.
Cheers.
I love myself.
Yes, I love myself.
In the mirror. You have to do it too.
Oh, okay. Thank you for joining us on this episode of Age to Perfection. We hope you enjoyed our discussion and found some valuable insight to help you on your journey. Be sure to tune in next time as we tackle how hormones change as we age and uncover tips on feeling fabulous at 50 with special guest Jamie Hatchett, FNP. Don't forget to subscribe so you never miss an episode. See you soon.